Welcome as well, everyone. We're so glad you're able to join with us this afternoon for this very important and also very timely discussion. Our first panelist today is Jeff Larason. Jeff is Director of Highway Safety Communications for Travelers Marketing, our partner for this webinar. And many of you may know Jeff. He previously served as the Director of Massachusetts' Highway Safety Division for about 6 years. And before that, he was president of Safe Roads Alliance. Jeff has over 35 years of broadcast industry experience focusing on transportation and safety. And another way you may know Jeff is that he is a very strong advocate of using the word crash, never accident, when we talk about what happens out there on the road. So I hope you will help me in welcoming Jeff. We'll do our, little bit of a round of applause, and I'll turn it over to you. Jeff, it's all yours.
Thanks, Pam. Hi, everybody. First of all, thanks to GHSA for putting this on. I think it's timely to talk about community engagement right now when everybody's kind of looking at their HSPs. So thank you. You all have a very daunting task in front of you. Your job is to get people to change their unsafe driving behaviors. And of course, the ultimate goal that we have is to save lives and to reduce crashes and injuries on our roads. And unfortunately, over the last couple of years, the data is showing that we've been going in the wrong direction for those crashes and injuries and fatalities. And we all also know that getting people to change their behavior is a very hard thing to do. But it's pretty clear that every state has at least like one problem area, some community or region where traditional efforts to solve the problem with safety hasn't been working. It might be a problem with impaired driving in this city or a terrible seatbelt use rate in that county. These are areas that we really need to try something new. So traditional messaging and campaigns have yet to move the needle in these communities. And there may be a lot of reasons for that. That might be geography or culture or language or technology or something else, whole sorts of reasons why these things can happen. But if you could just find a way of breaking through, if you could do that, then we can save some lives. Now, we've all tried this traditional top-down messaging approach with campaigns like Click It or Ticket and Drive Sober. And I mean, these campaigns have had tremendous success over the years. I mean, if you look at the seatbelt use rate in this country from 20 or 30 years ago to where it is now, where we're up over 91, 92%, that's an amazing trajectory and a success story for campaigns like Click It or Ticket. But unfortunately, not everyone has been reached. And now we need to find a way to reach those hard to reach people. And NHTSA's call for community engagement, it gives us the perfect opportunity to make that happen. Partner with the community, engage the community to develop grassroots campaigns. Now, since I left the Massachusetts Highway Safety Division, a great organization, I have started to lead this initiative with Travelers Marketing to engage communities. It's a new approach to behavioral change, and our number one requirement is effective and consistent collaboration with community partners. And so we have a 5-step process that we've been developing over the last 6 months, and we have been doing this while advancing a pilot project in Brockton, Massachusetts. So step 1, we look at the data. So we started with a deep dive into the data here in Massachusetts, and we saw that Brockton had the lowest seatbelt use rate in Massachusetts. And that's saying something, because Massachusetts has a very low seatbelt use rate. We're number 49 in the country. So Brockton was under 50% and has been for several years in a row. So we decided to test our approach in Brockton. Step 2, we learn about the community. So we wanted to know more than just demographics. We wanted to know more about the people of Brockton, what they do, what they care about. So we conducted research. We distributed surveys. We went out to the community, and we engaged the traditional partners that highway safety offices will work with, the police department, fire department, EMS, the mayor's office. But we went beyond that, and we engaged with non-traditional partners, community groups, houses of worship, public health officials, boys and girls clubs, and the YMCAs. And we met and we talked to them and we learned more about the community. Now, Brockton is a high minority community. Spanish and Portuguese, specifically Brazilian Portuguese and Haitian Creole, are commonly spoken there, along with English. They care about their neighbors and they attend church regularly. Step 3, we engage stakeholders in solving the problem. So we sought commitments from all of our stakeholders to work with us to address the seatbelt problem in Brockton. And we asked them for their involvement to craft the message with us, to be the creative element in developing that message, something that would resonate with the community. And then we asked for access to their networks to deliver the message, to create additional connections with other community members as well. And I'll tell you what, we didn't have a single community stakeholder decline to participate in this program in Brockton. Our goal is to meet people where they are and to create opportunity for peers to speak to peers with a professionally crafted and developed message. Number 4 is we leverage the private sector and we amplify the reach and influence of the community stakeholders by working with private companies. So by creating these partnerships with private sector organizations, which is, by the way, a specialty of travel business marketing, we can learn how to best disseminate the community's message and to expand its reach. And then the last step is we assess and we measure and we analyze and we use that information to adapt. So we assess the effectiveness. Has the community engagement changed behaviors? Will we see an increase in the seatbelt use rate in Brockton? Hopefully we will. So there's a lot of work that goes into community engagement, and it's hard work. It's a challenge, and we have a dedicated team at Travelers working, supporting every step. And we've been talking to a lot of state highway safety offices over the last 6 months to get a community engagement program like this included in the upcoming triennial HSP. And we would like to work with you on your programs to help you solve these problems in your communities, because if we can work together, we can save lives. So thanks for coming to the webinar, and I'll turn it back to Pam Fisher, and I'll take any questions as they come later on. Thank you.
Thanks so much, Jeff. And yeah, there will be some questions. We've already got a couple in there, so stay tuned for those. And I have a couple for you as well. Jeff, you made it very clear that you went into Brockton and we're telling Brockton what to do. You sat down with the community and really talked about this. And Troy, of course, you brought it up as well. You need to get into the communities. You have to go to the communities. This is hard, guys. This is really hard, right? This is a big change. And so I want to understand, I want to understand more about approaches to this. What are those, what are those lessons you've learned from doing some of this work? And also just thinking about, how do you open that door? Here we are, we say we want to help a community or we want to work with a particular group, but how do we really do that? It sounds so easy the way you present it, but it's hard work. So who wants to dig into that first?
Well, I'll jump in.
I know this is not a shy group.
I mean, I think that the thing, when we did our pilot, or doing our pilot in Brockton, I think the one thing that was most interesting to me was how little people knew about the problem in their community. So in Brockton, I met with people at the Brockton Hospital, the director of emergency care there, and told her that your community has the lowest seatbelt use in the state, in a state that has almost the lowest seatbelt use rate in the country. And that's one of the reasons why you have all these crashes. And it was like a light bulb went off with her. And it was like that with everybody that I talked to in Brockton, is that to give them that information about what's happening in their community that they don't necessarily have. And that generates the engagement. It's step one in that process, is start with the data, let them know about the data. And the community engagement, getting them to be part of the creative process. I mean, they've never been, in a lot of cases, they have not been part of that. It's because it comes from federal government to the state government saying, here's what we're going to give you, and talk about seatbelts with this. But in our case, we're trying to have them generate that creative input in their own languages. So we work with them in Portuguese and Haitian Creole and Spanish. And but the thing that was most amazing to me is they just didn't know a lot of the data.
There are some situations where you potentially want to work with a grantee in some of these communities that have not been served before. And oftentimes these may be they're not familiar with, how all this works. We have a certain structure that we've used forever. And also they may be small staff. They may be, they're really challenged. So how do we, state highway safety offices, how do we come and meet them somewhere? We can't just say it has to be this way. If you don't do it this way, you don't get a grant. So how do we find that flexibility? How do we make that work?
So what we're proposing is that you're working with, you're putting out an RFP for a media vendor who would take care of the activity. So the media vendor goes out and reaches out to the community, and they are the ones who take the lead on it, working with the Highway Safety Office to make sure that the goals are accomplished through it. But it's the same thing as working with a media vendor. You go out and you say, we're going to contract with this. The media vendor, whether it's Travel Marketing or somebody locally who does the same thing, they take forward, they carry it, they do the engagement with the community, they manage it, they manage the creative process in concert with the Highway Safety Office. So it doesn't fall onto the shoulders of the staff of the Highway Safety Office that's already strained to try to accomplish these things by getting it to outside of the HSD.
That's great. We need to go into the community, right? And we need to have the community invite us in. We don't just, it's not like breaking down doors. It is, finding those people. I heard Jeff say it, finding the community leaders. Troy said it too, and going into those communities. The beauty is we have Kelly Browning, we have Sandy Spavoni, who are working with organizations that have connections to youth all across the country, rural communities, urban communities, suburban communities. So that helps. That's a way you can help facilitate breaking down some of those doors. But thinking about the project, Jeff, that you did, or you are doing in Brockton, who did you know that was really engaged in the community? Because you have to be invited in, and it's not just, you go into a room and that is just going to happen magic. So I want to get a sense of, what are the lessons learned from that experience, and what are you continuing to learn as you talk to these folks?
Well, I think you hit it on the head. You have to have a community champion. And I mean, I knew from my time in the Highway Safety Division, I knew the police chief, and I knew folks who worked in the community. But it was through them that I was able to meet other people. They recommended, you should talk to this person. And just in the course of the conversations there, I met a pastor at a church in Brockton who had been in an unbelted crash 10 years ago when he was in the hospital for 2 weeks, because of the crash, and he just took the ball and ran with it for us. He's our champion there, and it's a lot of it is just learning who's there, talking, spending time there, learning, and a lot of it came from the surveys that we did, the information that we were gleaning from those surveys and how things were going about. But I know Sandy and Kelly were both talking about learning about teens. That's the case in whatever the problem area is, whatever the emphasis area is. If it's seatbelts or impaired driving, you need to learn about what the problem is beyond just the data that you get from the Highway Safety Office. It's that data from the community, the information about what they tell you. And I can't remember if it was Kelly or Sandy said it. You can't have the answer going in. The answer comes from the community.